Hello, my name is Dr. Sive Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida. And in this video, I'm going to talk about one of my favorite things to do, which is top surgery revisions. So I have to do my own revisions. Sometimes about 3% of my patients need them. Any surgeon who tells you they don't have revisions is lying. It unfortunately is an art, not a science, when it comes to how folks heal. In this video, we're going to run through the different types of revisions I see, and what I will tell you is I treat folks from all over the world who need revisions, and a lot of them had been somewhere along the line told that a revision was impossible, and I'm here to tell you that we can usually enormously help issues or fix them completely. Okay, we're going to start with the most common reason for revisions are the nips, especially when we're grafting them. So this is because there's a little bit of unpredictability with how that free nipple graft is going to take. Most of the time they do just fine, but there's a lot of different things we can do to fix them. So probably the most common issue I see from other folks' patients are nipples left too big. We're able to reduce the areola, we're able to reduce the nipple itself. Another issue I see fairly commonly is a lack of projection of the little nipple part as well, and oftentimes we can graft something else on there, maybe a little piece of the nip from the other side, and recreate that nipple there as well. Moving the nips is another thing we oftentimes do, and yes, it is very possible to move a nipple graft. Okay, reason number 2 somebody may need a top surgery revision is good old dog ears. So dog ears, basically there's too much skin and tissue left behind. Most commonly they're lateral dog ears, meaning they happen out at the side, although they can also happen in the center of the chest if a patient really needs the scar to meet in the middle and the surgeon doesn't do that. You can be left with a crease or lumps or kind of like ghost cleavage left behind in the center, which is a type of dog ear as well. I've never met a dog ear I couldn't fix. It doesn't matter what size they are. Usually we're able to hit a home run in this and get rid of them completely. The next type of surgery usually does require a general anesthetic. Typically it takes us about an hour, sometimes an hour and a half, and that is chest debulking. And it just really depends what's going on with this with patients. For example, this patient, we took the nipples off, redesigned them, put them back on again, and smoothed everything out. As problems go, having too much tissue left behind is actually a fairly good problem, because usually we can hit a home run with these cases and fix them like, you know, the problem never happened in the first place. Now we're getting into kind of the big leagues here. Things are a little bit more complicated, and we'll call them contour deformities, or where the chest isn't as smooth as we want it. Maybe there's sunken in areas, and this is a little bit more difficult. Like in this patient, this is actually a complicated case because we have some dog ears going on out at the side, but the main thing my eye is picking up on is how the center of the chest is sunken in. But here's the same patient just 48 hours after the revision, and sometimes what we have to do is what's called fat grafting, or injecting fat from parts of the body we don't want it into this area. Fat grafting can be a little bit disappointing because not all of that fat is going to take, but like I said, usually we can make an enormous improvement on what's going on with the chest. This is usually a general anesthetic and is usually a little bit less downtime than the original top surgery, and we never do drains. Okay, the next type of revision is a keyhole correction. So basically we see this in folks who probably shouldn't have had a keyhole surgery in the first place. Maybe there was too much skin, too much tissue there in the first place, or sometimes we get really unlucky. When we do keyhole surgery, we're asking that the body shrink back in the skin, and sometimes the elasticity is just not there in the skin despite our best efforts. This is why I'm super picky on who gets to have keyhole top surgery in my practice. I've had this happen to one of my patients, and he had some loose skin there, will need to be converted to a double incision. I haven't seen him back though, so if you're out there, come back, we'll fix it. But typically what we do in these situations to clear up the loose skin is just convert to a double incision with a free nipple graft, like in this patient. So those are the main types of revisions that I see in my practice. We always offer free revision consults, but you really have to wait at least 6 months after the original surgery because you may not even need a revision. You may just be healing. welcome folks from all over the world who need revisions, and this work is super gratifying because oftentimes we can completely fix something with just a 30-minute to an hour procedure awake in the office, so really minimal downtime for the patient. If this is something you're interested in, definitely reach out. I personally love doing revisions. I get to be creative and think outside of the box sometimes. They can be a little bit challenging, but like I said, the majority of things can be enormously helped or oftentimes completely fixed.